My name is Dr. Teresa Gildner, and I am an assistant professor of biological anthropology at WashU. My research focuses on how environmental factors and living conditions shape human health, especially infectious disease. We are currently in Cahokia Heights, about 20 minutes from campus, and I do research here looking at how lived experiences, there's persistent flooding here, sewage backups into people's homes, and also a lack of resources, including food insecurity, lack of access to nutritious food, and healthcare, and how that impacts human health and intestinal health. One of the graduate students who'd been here for a few years raised the issue that there's a lot of the types of issues that I study in my research in Ecuador and in the Mississippi Delta in Cahokia Heights. And I hadn't heard about that yet. We're in front of a home of a resident who lost her house, had to leave because of the flooding. This is an extreme example of something we see every day with our participants. They're in homes that are damaged. There's a lot of concerns about the water in general, and then people have also reported that once they moved to the area, developing new health problems that they never had before. So things like respiratory issues, potentially linked with mold in the home, with the flooding, the dampness, and then also intestinal issues, which is what I've been primarily interested in. One of the infections that we measure is a bacterial infection called Helicobacter pylori, or H. pylori. And some people may have heard of it in the public media because people talk about it in relation to stomach ulcers. So actually, when we started that, and I talked to researchers who worked more in that field, some told us that we weren't going to see H. pylori infections because it's the United States, and this is not an issue in the United States. But we've consistently seen fairly high rates of infection, including here in Cahokia Heights. I work with Dr. Claire Mosteller in Earth, Environment, Planetary Sciences, Dr. Liz Malott in the Biology Department, and then we also work with Dr. Fengchang Ling in environmental engineering. And more recently, we are collaborating with Dr. Bo Li. It's a multifaceted problem. So expanding beyond just the person to look at these broader levels like the environment, like collecting these environmental samples, collecting the flooding data, that can give us more context for what people are experiencing and what they're exposed to in the environment in ways that I couldn't do by myself. Academics have the resources, the expertise, the labs to help the communities that don't have those resources, especially in lower resource areas like Cahokia Heights, to help them to assess issues going on in the community, to give them data that they can use in their efforts to address social problems. Our WashU students have been phenomenal, and they've been so integral to the success of this project. The undergraduate students help us to collect data, to analyze it in the lab. Our graduate students develop unique projects to help to address concerns in the community and grow the project further. Science has the potential to impact both local communities, as we're trying to do here, but then also more broadly. We know that Cahokia Heights isn't the only community that's being impacted by these issues, and that it's going to continue with climate change making storms and flooding worse across the U.S., not just here in Illinois. Hearing that one of the participants said that my research was life-saving is really impactful, and it's something every researcher wants to hear. We just hope that our research can generate data that will have real, tangible change that improves people's lives in the community.